The next domino clinks over. For Mass General Brigham, starting on January 2nd, healthcare employees will wear facility-issued masks while interacting with patients in clinical care locations. I'd be interested to follow up with this and see if it's going to be N95 respirators or what kind of masks that they'll be providing. So if you work for Mass Gen Brigham Hospital, let me know. Where this policy will be enacted for healthcare workers that enter patient rooms or bays. However, it doesn't seem like patients will be forced to wear masks, that they are quote unquote strongly encouraged to mask while directly interacting with healthcare personnel. Additionally, we're going to be seeing mask measures from the Illinois Department of Public Health. However, this is only going to be focused to healthcare settings in areas of elevated transmission, where the Illinois Department of Public Health issued a health alert today to hospitals, long-term care facilities, and local health departments outlining various mitigation measures, such as the use of masking and screening, especially in areas where patients are vulnerable, where hospitals are advised to screen staff and visitors for symptoms of respiratory viruses and to remind visitors entering patient rooms about hand hygiene and cough etiquette. Again, the masks don't seem to be forced onto the patients for some reason. They're just telling them, wash your hands and cough in your shoulder. And Illinois is also asking non-urgent hospital visits to be deferred, so don't go. And they're also asking for patients to get tested for respiratory viruses before they go for in-person visits, or to alternatively use telehealth services if possible. Ultimately, the reintroduction of these policies are showing us that healthcare facilities are working to not be overwhelmed, that they're experiencing high volumes, and that they are worried about losing their healthcare worker to patient ratios. However, due to the types of laws that we've seen passed in terms of mask mandate bans, in a lot of places we're going to see these types of issues where private entities like hospitals can mandate masks for their employees but not necessarily for their patients, which further compounds our issues.